Mentakasngi kanyotrek unok pra arjar aphuai, la Plie ya ka precious wing absorption oxygen generator plan ha Nazareth hospital la umentri ka koit kakya u James Sangma ubalong ru ukong san ha kanik program. Ya kanika plan la baiting ka da katrat ka koit kakya ka jila ling ba ka Google garan bala aiso bha da ka sengpat give India bala pentri kam da ka konhun tata. Hakan di program layudan langru i Dr. G Rengat ibalong i Chief Medical Officer ka Nazareth Hospital, i Sister Norin ibalong i Administrator ka Nazareth, Uram Kumar, baru Sampat Kumar IAS, ki Dr. ki Nurse bat kiwe. Lasdang ikan ke program da kecing duai na i Vicar General ka Shillong Archdiocese i Father Richard Majau, la yo ru i kecing keren pediang puram da u Chief Medical Officer ka Nazareth u Dr. G Rengat bat kiwe. Habakaran na kanik program, umentri ka koit kakya ulayaro ya kanik hospital, kabala ay ka jingshakri kabapaka ya kipait ba kachala.
I would also like to first start by thanking God Almighty Father for this wonderful day. It's a beautiful day, and these are showers of blessings. And I know that God has been very kind on Nazareth Hospital, all the sisters who are working here, all the doctors, the paramedics, the nurses, and God continues to shower His blessings on Nazareth Hospital as we can see today. I want to start off by congratulating the Nazareth Hospital and the sisters on this wonderful inauguration of this oxygen plant, and really this is testimony of the fact that Nazareth Hospital has been offering human service to not just the people of Shillong but the entire state of Meghalaya. COVID has taught us many lessons about the importance of a robust healthcare infrastructure. And at the same time, unfortunately, it has also exposed the inadequacies of our healthcare system, which we must acknowledge. And we must come together to look for solutions so that we can rectify the flaws and avoid a repeat of tragedies by equipping hospitals with technologies and necessary infrastructure to minimize the adverse impact of pandemics like COVID-19. Fortunately, in Meghalaya, we could minimize the impact of COVID-19 because all sections of civil society, which includes traditional and religious institutions, came together and collaborated with the government, and private healthcare institutions like Nazareth, like Bethany Hospital, to work day and night towards providing medical care and support for all sections of society. In particular, missionary institutions like Nazareth Hospital, even before the pandemic hit us, were the backbone of medical healthcare and infrastructure in Meghalaya. When the pandemic turned our lives upside down, the frontline workers of such institutions were leading the way in providing much needed care and treatment to the public and providing support to many government initiatives. The government of Meghalaya acknowledges and recognizes the massive contribution of institutions like Nazareth Hospital, and this is why we have invested about 14.4 crore rupees in private hospitals to increase the readiness for a potential third wave. As Mr. Sampat Kumar, our Principal Secretary, had just mentioned, this is the way forward for the government. This has been laid down in our policy. And we feel that this sort of collaboration, this sort of partnership and mutual respect for each other is the way whereby we will bring transformational change in the healthcare sector. Out of the 14.4 crores that we have set aside for private hospitals, I'm very happy to inform all of you that 2 crores and 51 lakh has been invested in Nazareth Hospital. Apart from that, the Department of Health and Family Welfare has facilitated the Park Foundation, who are here, and would like to express a word of gratitude for them also, to donate this PSA plant in Nazareth by the Tata Advanced System to provide a stable flow of 800 lbm, benefiting 100 patients who will require oxygen support during critical times, possibly for a third wave, which we hope will not come, but yet we need to be prepared for. And I believe that this oxygen plant will be an asset not just for the hospital, but for the entire health system of our state. And I take this opportunity to wish Nazareth Hospital and the sisters and all the staff, the doctors, the nurses, the paramedics, and well-wishers of the hospital the very best as they add another milestone in their endeavor to serve the people of the state. As a representative of the government, I wish to assure that we will try our best to serve the people of our state to the best of our abilities, and I know that we have a dependable partner in Nazareth Hospital to try to provide access to timely and adequate healthcare to the people of our state. I once again congratulate Nazareth Hospital on this milestone, and I wish them all the very best in their future endeavors, and assure them of the fullest cooperation of this government in providing adequate and timely healthcare to the people of our state. God bless each and every one of you. Thank you so much. Kubai Shibun, Matela, Jai Hind.